Cool. All right. Hello, everyone. Welcome back to this little quick video series that I'm doing for this year's Black Maternal Health Week. Flower and Fox doula. I'm like kind of like officially a new doula here in Colorado Springs, serving from pretty much Denver to Pueblo. So if you're in search of a doula, I am here and I have availability for April. And then I won't have availability again until August. But welcome. I just quickly wanted to share that, focusing on this week and promoting maternal health care specifically, like in Black women and Black families, is like really important to me. But we want to just dive into just this journey of pregnancy over the next couple of days. This is supposed to be a time full of beautiful moments and big challenges together. But think of it like this: like you're essentially an athlete and you're training for like the big leagues, right? You're training for the Olympics, you're training for the World Cup, you're training for the Tour de Femme. Pregnancy is your time to prepare for one of life's grandest events, and that's the arrival of your little one. So you're pregnant, right? I'm pregnant. You peed on a stick, right? You missed your period or whatever. What's next? You'll most likely go to either your midwife if you're seeing a midwife, or you'll go to your OBGYN to confirm the pregnancy and to schedule out the next couple of appointments based on your medical history, right? So let's talk about that medical history. You might think you're super healthy and everything's amazing. Or vice versa, you might think you're not super healthy and you need to work on a couple of things. But one of the first things that you want to, or that needs to be addressed in your very first prenatal visit is whether or not your pregnancy is going to be considered high risk. So you'll hear high risk and low risk. And if you already know all this, bear with me. I just want to really break things down for people. So whether they determine if you're high or low risk will help you determine how you're going to effectively manage your pregnancy. It's all about preparing for before baby comes, while baby's coming, so during delivery, and then after your baby's arrival. A high risk pregnancy essentially means that you're probably going to have more visits to different doctors, to different specialists, to your healthcare provider, and probably conduct a lot more tests than low risk, I would say, because it's just high and low risk, right? So you'll probably do a lot more testing than someone who is a low risk pregnancy. And that's just to make sure that everything is on track. And there are just multiple factors that can impact whether you're high or low risk. So some of these factors include not just your medical history and age, right? Because they like to say 35 and over is a geriatric pregnancy or advanced maternal age, which is shocking because I'm now starting to feel good about life physically. But also your lifestyle choices, like do you drink alcohol? Do you smoke tobacco? Do you use recreational drugs? Do you use illegal drugs? And then also if you have any pre-existing health conditions, do you have asthma? Do you have diabetes? Do you have any heart or blood conditions? So it's important that you are completely 100% transparent with your provider, regardless of that, like who that provider is, right? Like I know we don't all have bougie healthcare, or we don't have really, the degree of like competence among healthcare providers varies, but you absolutely like to make sure that everything is documented. You have to be completely transparent with your healthcare provider. So if you're like, yeah, I smoked for like 6 months when I was blah, 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 like you need to let them know that all of that is important because it can impact your health throughout, during, and after pregnancy. Like I said, if you're identified as high risk, some of the like different things that a healthcare provider might tell you to look out for are things like really severe headaches, not migraines, just like a severe headache that won't go away no matter what you do. Any unexpected swelling in your hands, in your feet, especially very early on in pregnancy. If there's any decrease in fetal movement. So if it's your first pregnancy, it might take you a longer time to feel your baby kicking. you're following pregnancies, like you're familiar with that, fluttering feeling in your lower abdomen of your baby, and like obviously they get bigger and they kick the shit out of you, like they kick your lungs, they kick your bladder. So those are all things that, and you're gonna take this all in bite size, right? Take pregnancy like literally 1 month at a time. But be aware that like your health will impact the health of your child and your entire experience, and you really need to be conscious of that. So remember, pregnancy, particularly a high-risk pregnancy, can be very emotionally overwhelming. And it's okay if you feel stressed and anxious, but if you do start to feel helpless or hopeless, it's important to know that there is the National Maternal Mental Health Hotline, or you can call and text 988, which is the crisis lifeline and suicide prevention hotline. And I think a lot of people like to like put down their, like how they're feeling, like, well, it's not that bad because I'm in XY situation. Like, don't do that. If you are feeling, again, anxiety, stress, overwhelm, that sense of like hopelessness, you got to use those resources to benefit you, and don't compare what you're going through, and don't minimize it because of what someone else, maybe a friend or a family member, is experiencing in their pregnancy. You are not alone. I mean, you could DM me, I will call you, but there's always someone out there that's ready to support you, whether they're part of your community that you have, or maybe you're by yourself, maybe you're a single parent. There is a community, they exist, and you can find them and reach out to them and be proactive about it. Ask your provider if they know of any mom groups. There's a ton on Facebook, I know, and Instagram and social media, but those can get overwhelming at times too, because it's like thousands of moms in these groups. But your provider should be able to provide you with, no pun intended, with a support system, access to a community, and access to resources. So just kind of back to that, if you are high risk and your doctor says, hey, you're high risk, okay, so what? What is in it for me, right? It's not the best news, but you need to ask them, like, well, do you have like a comprehensive plan that I can start implementing immediately that can help me prepare for any unforeseeable challenges or circumstances during your pregnancy? So like help when it comes to managing diabetes while your pregnancy is important. And then also, if you have any, like if you're having twins, right? Like what are some of the resources they can provide to you to help you, a first-time mom of like multiples? Because it's not just the doctor that can help. They have tons of resources. The other thing you want to think about too is diet and exercise. Obesity, which is somewhat prevalent in the Black community, in the African diaspora, I would say, it will definitely impact your pregnancy. There's no denying it. So you obviously can't go and start being like a bodybuilder while you're pregnant, right? But there are steps that you can take to help mitigate the impact that obesity will have on your pregnancy. I like to tell people to like take it a little bit, like don't do extremes. If you didn't work out before, don't go and start some crazy ass workout. Your body's just going to be like, what the heck? It's also probably not sustainable. And you're going to quit after like 3 weeks, guaranteed. So just take it a little bit at a time. And what I always like to recommend to people, just go and walk. Walk every day. Walking is the most underrated exercise in the world. Not only is it physically good for you, it's amazing for your pelvic floor and your core and your hips. Most of us sit all day unless we live like on a farm or a ranch. You have a pretty sedentary lifestyle. If you think you run 5 miles a day, and then you come to work at a desk all day, what you're doing at your desk is counterintuitive to your run that you did that morning, right? So start off really easy, if you're not already physically fit, and start off walking. And you can start off 1 mile a day for like 1 week and then bump it up to 2 miles a day. Or you can do it by time. You can really start walk for 20 minutes and 30 minutes. But you really, at the end of the day, you want like 150 minutes of walking to, of 150 minutes of exercise throughout your entire week. Yeah, so again, just focusing on some of the challenges that we have in our community. It's like obesity and diabetes. You really want to manage your diet. So ask your doctor, can you refer me to a, registered nutritionist, right? Not like Joe Schmo on the street who's selling his meal prep plan, or not any of these big brands that are like on Instagram selling all of this, like this meal prep and that meal prep. It might not suit your lifestyle or your health concerns. Get with a registered dietitian and have them help you develop a plan that's simple, that you can put together once a week and store. If you're into meal prepping, if you're like me, you don't like to meal prep, you want fresh food, same thing. You definitely want to go and see a specialist. I cannot stress that enough. These are all things that you can ask your doctor for referrals. And then the other thing I would demand of my provider if I had a high-risk pregnancy would be referrals to physical therapists and pelvic floor therapists. They might actually not have a clue, but they're obligated to do that research and come back to you with some referrals. The reason I say this is the stronger your core and your pelvic floor are before your baby starts getting big and getting in the way of things, the easier it is to recover postpartum. Public service announcement, it is not okay to like pee yourself while you're working out, like running and being like, oh, I gotta pee every 2 minutes. That's not okay. Go get a pelvic floor assessment, and don't just assume that that's clearly it's common, but it's not normal, right? It's not normal to pee on yourself or have incontinence issues. So ask for those referrals, and then your doctor should provide you, they like to give out little like magnets that you can put on your fridge. And they are like kind of like reminders of like who to call in case of what. And they also tell you if you see, if you're experiencing spotting or cramping, like what do? You go to an ER. I know for me, they were like, if you're experiencing any of X, Y, and Z prior to 34 weeks, you need to go to the emergency room at this hospital. And then they were like, if you're post 34 weeks, you need to go to labor and delivery. So just understanding, like, if you're experiencing anything of that nature that is out of order, that you go and seek help immediately, especially as it pertains to preeclampsia. Now, you're not a doctor. So if your doctor is like, are you experiencing symptoms of preeclampsia? Don't say yes or no. Say, what are those symptoms? And then have them list everything out for you. And they should be asking you that every time. Are you experiencing headache? Are you experiencing swelling? Are you experiencing your blood pressure? Like, they should be listing it out, not saying, oh, are you having symptoms of preeclampsia? Unless you are a doctor, an OB, you have no clue what those symptoms are, and you're going to forget from the last time they asked you. So keep that in mind. Every time you walk in there, they need to ask you, are you experiencing all those symptoms? And you write them down for yourself as well. Put them on a sticky note. Put them on your mirror in your bathroom. So that's just I know that was a lot. It was way longer than I wanted to talk about, but since we're here, we'll talk about, I'm going to talk about it and share that knowledge. So I just want to thank you for tuning in today. And I want you to remember, if, every pregnancy is unique, even your own. Like, I had 2 completely different pregnancies. But the preparation and awareness that you have, as well as the support that you can garner, is going to make a huge difference. We're not meant to mother and be pregnant alone. So if you find yourself in that situation, ask for those resources and ask for that community. So stay tuned for more tips, more stories. Make sure you follow me for more. Like the content, share the content, comment on the content. I'm going to ignore trolls and negative content. I'm not going to respond to you. But until next time, just, keep taking care of yourself. Be aware of how you can take care of yourself. Do that research. because as a mother that's got a little baby cooking in you, you are a miracle in yourself because you're creating and growing and nourishing a life. Yeah, so thank you. Till next time. Bye.